Hello everyone, and welcome to my health and wellness channel. I'm Dr. Anas, a physician with more than 20 years of experience specializing in internal medicine, public health, and nutritional science. Throughout my career, I've helped thousands of patients manage and overcome urinary tract problems. And one of the most common conditions I encounter is cystitis, also known as bladder inflammation. In today's video, I will provide a comprehensive, in-depth, and medically accurate overview of cystitis. Together, we'll explore every essential aspect: what cystitis is, its causes, the risk factors that increase susceptibility, early warning signs, and how to prevent complications. I will also highlight 10 specific foods that individuals suffering from cystitis should absolutely avoid, as well as 7 groups of natural, soothing foods that can help relieve inflammation, promote bladder healing, and reduce the risk of recurrence. This is going to be a long, detailed video, perfect for those who truly care about their health or that of a loved one. I encourage you to watch until the end so you don't miss any vital information. What is cystitis? Causes and types. First, let's clarify. Cystitis refers to inflammation of the bladder lining, an organ responsible for storing urine before it's expelled from the body. The most common cause of cystitis is bacterial infection, especially from a bacterium called Escherichia coli, or E. coli. This organism normally lives harmlessly in our intestines, but under certain circumstances, it can travel through the urethra into the bladder and trigger an infection. However, not all cases of cystitis are infectious. Other possible causes include chemical irritation from feminine hygiene products containing harsh fragrances, soaps, or deodorants, mechanical irritation resulting from sexual activity, improper use of tampons, or even frequent catheterization. Hormonal changes, particularly in postmenopausal women, where reduced estrogen levels make the bladder lining thinner and more vulnerable. Weakened immune system, which makes it harder for the body to fend off bacteria. Certain medications, like chemotherapy or pelvic radiation therapy, both of which can cause chemical cystitis. In terms of classification, cystitis falls into 2 main categories. Acute cystitis, sudden onset with prominent symptoms, usually responds well to short-term treatment. Chronic cystitis, recurrent or persistent inflammation that can damage the bladder over time, if not properly managed. Typical symptoms include a burning sensation while urinating, frequent urges to urinate, often with small urine volumes, feeling that the bladder isn't completely empty, lower abdominal discomfort, especially around the pubic area, cloudy, foul-smelling, or even bloody urine. In severe cases, mild fever, fatigue, and appetite loss. If left untreated, cystitis can lead to serious complications like kidney infections and even kidney failure. The link between cystitis and bone health. Now, here's a connection that many people overlook: the relationship between chronic cystitis and bone health, specifically osteoporosis. Why is this relevant? First, people who frequently suffer from cystitis often develop a fear of drinking water. They restrict fluid intake to avoid the discomfort of frequent urination. This chronic dehydration disrupts the body's mineral metabolism, especially calcium absorption, leading to increased risk of osteoporosis. Second, long-term or repeated use of antibiotics, corticosteroids, and anti-inflammatory medications in managing urinary tract infection can decrease bone mineral density over time. Third, postmenopausal women face a dual risk. Their declining estrogen levels make them more vulnerable both to recurrent urinary infections and bone loss. Additional contributing factors include chronic stress, poor sleep quality, inadequate nutrition. In my clinical practice, I always emphasize the importance of protecting bone health when treating cystitis, especially in women over 50. Osteoporosis prevention tips for people with cystitis. Here are some essential strategies to protect your bones if you are dealing with cystitis. Stay hydrated, even when symptoms flare. Ensure adequate water intake, 1.5 to 2 liters per day, to support kidney and bladder function, and to maintain mineral balance. Boost calcium intake. Consume dairy products like milk, yogurt, and cheese. along with plant-based calcium sources like tofu, almonds, and dark leafy greens. Ensure vitamin D levels. Spend time in morning sunlight or include foods like salmon, eggs, and fortified cereals in your diet. Engage in weight-bearing exercise, walking, yoga, or light resistance training helps stimulate bone formation. Limit caffeine and alcohol. Both can worsen urinary symptoms and contribute to bone mineral loss. Stop smoking. Tobacco accelerates bone loss and weakens bladder immunity. Manage stress and sleep. Both are essential for hormonal balance and overall recovery. 10 foods you must strictly avoid when suffering from cystitis. Now, let's focus on dietary triggers. These are 10 foods and beverages that I strongly advise my cystitis patients to avoid. Coffee and caffeinated drinks. Caffeine is a bladder irritant. It increases urgency and worsens burning sensations. Alcohol. Alcohol dehydrates the body and lowers immune defenses, making infection more likely. Carbonated soft drinks. The combination of sugar, caffeine, and carbonation exacerbates bladder irritation. Citrus fruits and juices, oranges, lemons, grapefruits, tomatoes. These are highly acidic and can worsen inflammation. Spicy foods, chili, hot peppers, mustard. Capsaicin compounds irritate the bladder lining, intensifying discomfort. Chocolate contains caffeine and theobromine, both known bladder stimulants. Sugary snacks and candies. Excess sugar encourages bacterial growth in the urinary tract. Processed meats and packaged foods, sausages, canned meats, fast food. These contain high levels of salt, preservatives, and artificial additives. Pickled foods and vinegar-based products. Their high acidity can irritate an already sensitive bladder. Artificial sweeteners, aspartame, saccharin. Some studies suggest these may trigger bladder spasms in sensitive individuals. 7 soothing foods that help relieve pain and support healing. On the positive side, here are 7 food groups that can help calm your bladder and promote healing. Pure, filtered water. Drink small, frequent sips throughout the day to dilute urine and flush out bacteria. Unsweetened cranberry juice. Contains proanthocyanins that prevent bacterial adhesion to the bladder wall. Pomegranate juice. Rich in antioxidants and anti-inflammatory compounds. Berries, blueberries, blackberries. Loaded with phytochemicals that soothe the bladder lining. Probiotic-rich foods, yogurt, kefir, fermented vegetables. Support gut and urinary tract microbiome balance. Omega-3 rich foods, salmon, flax seeds, walnuts. Help reduce systemic inflammation, supporting bladder health. Pumpkin seeds and sunflower seeds. Provide essential minerals like magnesium and zinc for bladder muscle function and immune support. In summary, cystitis is not just a minor inconvenience, it's a condition that, if neglected, can lead to serious complications and greatly impact your quality of life. By understanding the causes, identifying risk factors, making smart dietary choices, and implementing preventive lifestyle changes, you can reduce your symptoms, promote healing, and prevent recurrence. If you found this video helpful, please subscribe to my channel, give this video a thumbs up, and share it with others who may benefit. Feel free to leave your questions or experiences in the comments section below. I read every comment and do my best to respond. Thank you for spending your valuable time with me today. Stay healthy, and I'll see you in the next video.